Welcome back to the afternoon, everyone. And lunch was wonderful, so I hope that you've gotten a chance to enjoy some California sunshine with your meal. It's my great pleasure to introduce to you the Dean of our School of Medicine here at Stanford. Before I do that, I want to give a shout out to our Division Chief of Primary Care Population Health who's here, Dr. Song Chang. Thank you for coming. Dr. Chang has been a great supporter of Asian health and has been very instrumental in helping us move forward over these last couple years in Asian health. I am excited to introduce Dr. Miner. He's the Carl and Elizabeth Naumann Professor and the Dean of the School of Medicine. He's a professor of otolaryngology. He has trained at the elite institutions of the United States, including Brown, Johns Hopkins, Duke, and the University of Chicago. He has been Dean of the Stanford University School of Medicine since 2012. When he came, I was very impressed as a faculty member at his vision for precision health, and he'll talk a little bit about that today in his comments. And 2 years ago, when we kicked off the Center for Asian Health Research and Education, the dean is a very busy man, and he made time to come and speak at our kickoff. And he understands and promotes the idea that we need to study diverse populations in order to provide precision health for all of our patients. 1 out of 3 people who walk through the doors of Stanford healthcare are Asian. And in order to provide the research in these populations so that our doctors can provide better care for them, we need to move forward with education in these areas so that we can train the next generation to take care of over half of the world's population. So please join me in welcoming Dr. Miner. And again, because I said study sedentary behavior, please stand up and give him a standing ovation. Thank you.
Well, thank you very much, Latha, for that very kind introduction. And I want to begin by thanking Bryant and Juha and Robert for organizing this wonderful conference and for the work that they and so many others do in making sure that the Asian Health Research and Education Center is so phenomenally successful. It's been gratifying and heartwarming to watch the programs that are supported by the center grow and thrive, and to watch the impact that the faculty and students and others involved with the center are having, not just here in the Stanford community, but nationally and internationally. You know, as I look out in the audience today, I see so many of you that I know have devoted your life to research, education, and patient care regarding issues, health-related issues that affect Asians, Asian Americans, and people around the world. I'm looking at, to my left here at Sam So, who I've had the privilege of really getting to know over these past several years and celebrating his successes and having the opportunity to honor Sam at several national and international events. And I think it's such a compelling story that Sam, a surgeon, dealing with the downstream effects of a truly disabling, life-threatening disease, namely liver cancer, and being a great surgeon, but also looking at, well, what can he do? How can he have impact at predicting and preventing that disease? And of course, then subsequently founding the Asian Liver Center and promoting vaccination for infectious hepatitis throughout regions of Asia. And it really takes the vision of people like Sam, like Latha, like Juha, like Robert, to make those aspirations become realities. I'm delighted that this conference is focusing on the topic of gastric cancer. Gastric cancer is a disease that really displays, I think, the opportunities that our precision health vision offers, in that we know that we can be much better at predicting, preventing, and ultimately curing gastric cancer. We're learning more and more, thanks to research being done here, about the risk factors and the genetic-related predispositions that make a person at higher risk of developing gastric cancer. And from that research, we're better able to determine who should be screened, how often they should be screened, and the type of screening methods that should be used in order to prevent a very early stage gastric cancer or dysplasia from going on and developing into an invasive and what could ultimately be a fatal gastric cancer. And in addition to that work going on in predicting and preventing gastric cancer, of course, we're focused on what we can do to treat and ultimately cure the cancer when it does occur. And all of that occurs because of the amazing faculty, students, and staff that we have here at Stanford University and Stanford Medicine. I have the privilege every day of working with our great faculty, with the students that come to train and learn from our faculty, and to work in this amazing ecosystem with so many talented people, with so many resources, and with such a clarity of purpose, which I think well characterizes what we do here at Stanford. I wish you the very best to have a very productive and informative conference. We always appreciate your feedback. I certainly appreciate your feedback on what we're doing, how we could do it better, other things that we should consider doing. So please do stay in touch. And Latha, thank you so much for inviting me to make remarks. I wish you a very successful conference. Thank you.